Welcome to Community Health and Infrastructure Assessment. I will try to make this fun, exciting, and challenging for you with only the minimal stress that we all know is part of any learning experience. The course was developed to provide students the opportunity to assess the health and infrastructure of a community. They are inextricably linked. The course introduces community health assessment and infrastructure assessment. You will be introduced to the information and the resources available to secure and improve resilience in the community's health and public health infrastructure. You will also be given the opportunity to work on a community-based health assessment project with me. Much of the experience will be practical and hands-on. Our objectives are to compare and contrast community health theories and define health within the community and its determinants, to analyze health within the community and its determinants, to discuss different models of community health improvement, to develop skills to mobilize communities to build capacity and improve health status of the community, and to devise strategies to engage community partners and stakeholders, and finally, to develop community health action plans using principles of community-based participatory research. I'm Roberta Levin, and I will be your instructor for the course. I've not always been an academic. Prior to transitioning to an academic career, I had 20 years of public health leadership experience, building partnerships, working in demanding leadership roles, and solidifying relationships with public and private stakeholders. I spent 20 years as a U.S. Public Health Service officer. I've worked in prisons, in public health emergency preparedness, and many other places. So you might think that this is about hospitals and that is the infrastructure of healthcare. Or you may think, well, we have to add the doctors and the nurses and all the other people to provide care to address community infrastructure. But that's not the whole goal of what we're here to do. We're going to monitor trends in health status, determine the available resources, and finally, we're going to identify our priorities. No, this is not a course about emergencies and disasters and looking at how we resolve all of those problems, although we'll talk about that. But really, it is about the people whose health matters. And for us, that is everyone in a community. Healthcare, health status, access to the things we need is a basic human right. And to make sure people have all of the resources that they need, we need to assess the status of our community. And to do that, ideally, we should go in a stepwise process. Step one is to establish a community assessment team, and for this course, that is us. Step two is to collect community data, and we will be doing that for the community we are assessing. Step three is to analyze and collect community health statistics. And we're going to be collecting all the data we can from all the sources we can. Step four is to combine both the county or the city statistics and community data that may be available. And that may come from non-governmental organizations or private sources, or it may just be things we find on the web. Step five is to get input from the community of people that we are interested in. Now, when we talk about the community that we're interested in, that can be the healthcare system, the government, it can be NGOs, or it can be other groups that are socially active in the community. The next step is to write up what we found, and then we want to make sure we get consensus, and we want to spread that information. We want to make sure that other people see it and can reach agreement with us. And then finally, we want to create a community action plan that we can share broadly and is useful enough that other communities might be able to learn from it, adapt it, and edit it to their needs. For our purposes, we are the team. We are the team that's going to come together and do this community assessment, and we're going to